This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
There's a tear in your eyes, I know, I can feel that it's
What
not
a rainy afternoon we have for today, but and because we have a very interesting topic for this afternoon. And before anything else, would like to introduce to you my female co-host, a very beautiful Dr. Glaiza Dapal. Good afternoon, Dr.
Good
Glaiza.
afternoon, Dr. Cenica. It is indeed a rainy afternoon, but we're not going to make this a gloomy one. And we're going to discuss all about scoliosis,
Yeah.
which is a very good topic.
Is there a solution?
Exactly.
That's a question. So for our televiewers, you can text your questions regarding our topic regarding scoliosis. Definitely there will be a lot of texters, no?
Yes.
There's a lot of patients who are suffering for
From
this kind of
scoliosis.
problem. You can text us 0925 852-0815, and please indicate your name and your location where you are at right now. And for our lucky texters, we have our 2,000 pesos worth of gift certificate courtesy of Janssen Cosmetic Surgery. Nobody does it better. Yeah, it's Janssen. So, dapat ano kayo, mag-text kayo na mag-text para manalo kayo ng 2,000 worth of gift certificate. And I'm very, very excited to introduce our guest. Alam mo, medyo parang alanganin ako ngayon kasi nag-iba tayo ng pwesto. Dati doon tayo sa kabila eh.
Sa other
Ngayon,
side
dito tayo
tayo.
sa side na to, no? And yes, for our topic, it's all about scoliosis. Is there any solution? Is it surgical or non-surgical?
Non-surgical.
Yes, and I will give you the pleasure to introduce our first guest.
Yes. It is my pleasure and honor to present to you all our guests for today, but I will start with the President of ScolioCare Corporation, Ms. Aimee Certeza. Good afternoon.
Good afternoon. Yes. So you're the President of ScolioCare Corporation, and I would like to introduce also the Director and Founder of ScolioCare Corporation, Dr. Anthony Fong.
Good afternoon. How are you?
Good
Welcome to
afternoon.
What's Up, Doc.
Thank you.
Yes. Well, you know, you've been in the practice of treating scoliosis.
Scoliosis,
Yes, using what we call spine core.
Yes.
Okay. Okay. What's can you tell us about the company, the ScolioCare? I mean, when this was found, and what does it do? I mean, is it international corporation or is it just here in the Philippines? Yes, Dr. Fong.
The company was established back in March 2016. It came about because we had quite a lot of inquiries, so we have our own branch in Indonesia, and we used to have quite a lot of patients emailing us, contacting us from Philippines if there are any solution to scoliosis. So one of the things that we did was we came to Philippines and realized there was a very big market for it. And a lot of patients were telling us that they're either suffering from scoliosis as an adult or as a child. And we we gave a lot of presentations to many different hospitals. So not only in Manila, but down south also we went to Philippine Orthopedic Center. We also went to SBMC. So we had a lot of rehabilitation doctors, spine doctors who know about this, but it just wasn't available here.
Yes.
So we established the company to bring in the products. But however, one thing is that in order to use this product, all the doctors have to be trained.
Right.
So it is unfortunately not a product where you just buy it and then you
It's
just
the
apply it on
training.
the patient. You need the training.
First of all, can we define for the benefit of our televiewers what is scoliosis?
Scoliosis.
Yes.
Scoliosis, when we look at the spine, traditionally we always look at someone who has either a tilt or rotation in the spine. So the most common classification is either you have a tilt in the upper body. It's usually either on the left side, right side. You might have a tilt in the lower back, left side, right side. Or you might have a double curve or C curve, or you may have rotation. Unfortunately, for over the last few years, and actually since 1992, there's been a lot of research into scoliosis, and they realized
So it's just there on our screen.
that's one of them, our case before and after. So there was a patient that was 33 years old, and before bracing was 26, after bracing was 18.
I've seen a lot of these
It's
cases.
quite a
And
lot.
what's the cause of this, what you call scoliosis? Of tilting the spine, like
There's
tilting
been
the
quite a lot
spinal
of
column
theories,
cords.
because one of the things is that let's say if you're an adult, usually there's 12 different types. If you're a child, there's 27 different types of scoliosis. So when we look at the spine, there's been a lot of theories. Is it a neurological problem? A lot of the rehab doctors actually said that is it a muscular imbalance issue?
Muscular
And
imbalance.
then orthopedics will say it could be growth issues or asymmetry. Now, there's been research into it, and they found that there's a very strong genetic component involved.
Oh, okay. How about
And
positioning of
the
body positioning?
there's been a lot of theories.
Because you know right
where,
now, because
yes,
people are very,
hunching and
we do a lot of yung mga iPad,
that's right.
texting, positioning is very
Gadgets.
important. Even the sitting position,
That's
even
right.
in driving, because of especially in traffic, no?
Yes.
Prolonged traffic. And what will be your advice? These are one of the causes of, I think, of scoliosis. And makita mo in here in the Philippines, some of the jeepney drivers, when they drive, is like this.
One side.
Yeah,
Oh, I've
one-sided,
seen that.
yeah.
I've seen that. Yes.
Yeah.
Traditionally, it's always been believed that bad posture causes scoliosis. However, there's been a lot of research showing that if you have bad posture, it doesn't cause scoliosis. However, if you do have scoliosis, then it predisposes you that if you have bad posture, it actually makes your scoliosis worse. But that being said, long-term bad posture can slowly lead to postural imbalances,
Okay.
and then that can also lead to other forms of scoliosis
Yes.
rather than structural or.
Dr. Fong, in terms of the angulation, because
Yes.
we were actually talking about the curve,
Yes.
the normal curve versus the abnormal curve of the spine, okay? In terms of the angulation, when do we suggest our patients to have the brace, and when do we suggest the patients to undergo different modalities?
Let's like
That's-
any kind of like therapy.
Guidelines,
Yes.
yeah. That's actually a very good question, because when we look at any kind of guidelines, it's usually based on what sort of treatment is available at that point in time. So traditionally, it's always been the hard brace. So guidelines were created where if they measure your curve, where they look for the spinal bone that is the most tilted on the top, the one that's the most tilted at the bottom, then they draw a line across, and they
Okay.
get what we call a Cobb's angle. So if it's between 0 to 10 degrees, it's classified as being normal. Anything more than 10 degrees is scoliosis. But then if you're between 0 to 30 degrees, it's classified as being manageable. So traditionally in the past, if you were manageable, they'll say, well, do some exercise, do some rehabilitation. And then once you go past 30, 40 degrees, then they'll recommend a bracing. But this is using the hard brace as a reference point.
Yeah.
So
Okay.
if you use a hard brace for a curve less than 30 degrees, you may potentiate or weaken the spinal muscles.
Yes.
That can lead to further scoliosis. And depending on the country, some countries at 40 degrees and above, they recommend surgery. Some countries more conservative. Some would be 50. And for example, like in UK or Australia, sometimes the surgeon may wait until 60 degrees.
Right.
So, but however, with spine core, because it's actually not a hard brace, it does stimulate muscular stimulation, joint, nerve stimulation. So if the spine is between 15 to 50 degrees, you can
Yes.
actually use the bracing.
Miss Amy Sir Tessa, the president of the corporation, how did you get involved with this corporation? Are you in the medical field or?
Engineering field po.
Mm-mm.
And may binigay lang po sa aking kaibigan ko na
Okay.
naghahanap sila ng maggagawa ng permit,
Ah.
and kailangan po nila makapunta, makapasok ng Pilipinas.
Philippines.
So, inintroduce
Because
po
they
ako
are
ng kaibigan
international.
ko.
ScolioCare
Yes.
is,
Opo.
if
International
correct me,
company.
it's an international firm.
ScolioCare is registered in Philippines.
Yes.
But
But,
it's
overseas we have another
originated really from.
ScolioCare is originated from here, but SpineCore is from United Kingdom.
Oh, okay. So
Um,
SpineCore and
SpineCore is the
ScolioCare is
product,
different.
but
Okay.
the company.
So how
is
did they
Scolio
find you? I
Corporation.
mean, as the president of this company, it's just because you're just a Filipino and anong background mo? Kasi scoliosis is a very common problem not only here in the Philippines but
Yes,
all over the world
worldwide.
because probably of the lifestyle, you know. And you as a president, how did you get involved with this kind of business? I mean, I could say business, the defining or for the cure of scoliosis and for the treatment. And this is like more of, is it a prevention or is it a treatment?
So, Doc, nakilala ko po sila kasi once na nag-enter po kayo sa Pilipinas, naggawa po kayo ng business,
Yeah.
kailangan po natin ng mga legal papers,
Of
ng
course,
permits, which
yes.
is, yun po yung expertise ko,
Uh-huh.
na from barangay clearance permit
So you're
up
the
to,
one who's making all those
established.
permits
Opo.
and mga licenses.
license. Opo.
Okay, and then, so how did you been educated dito naman sa
Regarding
sa
sa
business na to?
corporation
Oo.
also.
So, nakasama na po nila ako sa ScolioCare Corporation and na-train po nila ako kung ano po yung ScolioCare, para saan po
Okay.
ito, at ano po yung kagandahang maidudulot nito
Mhm.
sa mga pasyente po na kapwa Pilipino natin.
Yeah. So how did you started advertising this or market the products, the spine core?
Simula po nung nagkasama-sama po kami ni na
Mhm.
Dr. Fong, ni Ma'am Jeannie and Miss Amanda. Si Miss Amanda po yung kauna-unahan naming pasyente.
Okay,
Na-
Miss Amanda.
Yes.
Mhm.
Miss Amanda Bonifician
I
po.
saw the pictures.
Yes. And
Very
so,
good.
kailangan po natin ng trial. Kung
Mhm.
talaga po ba na effective
Yeah.
at sigurado po ba ito na makaka-cure, or
Mhm.
kung ito po ba ay talagang karapat dapat natin tanggapin sa ating bansa
Mhm.
upang makatulong po sa mga pasyente na mayroon pong
Ito ba kailangan,
Scolio.
sabi mo, licensing? Ito ba itong mga gadgets na to, or I don't know, I
Yes
haven't seen
po.
it. And ito ba kinakailangan pa naman ng mga FDA approval?
po.
Do you pass on that kind
yes
of
po,
Yes.
exempted po
Yeah.
kami sa FDA.
So,
FDA?
in short, pumasa talaga yan.
Opo.
Guaranteed yan.
Yes po.
And since nag-undergo yan ng clinical trials,
Yes po.
you'll also have to prove na it actually works.
Yes po.
Yes.
The product has been around since 1992
1992.
in Canada, UK. It's in over 22 different countries.
Okay.
So the clinical research have actually shown it's 89% effective for correction or stabilization of scoliosis compared to the other devices out there. It actually has been shown to be one of the most effective. So that's one of the reasons why we decided to bring this to Philippines because compared to other options,
Yes.
you have to do what's best for the patient.
Do you have
Yes.
any statistics of how many patients or how many people in the population, especially here in the Philippines, suffering from scoliosis? That's why you got an interest of coming here.
Okay.
You know.
We had a discussion with Department of Health when I was here last time,
Okay.
and they did mention that they don't really have the statistics available. However, if we look at the statistics, say around the world or in Asia, it seems to be quite high in Asian countries. So on average, anywhere from 2% to 5% of the population. So with
okay.
Philippines having over 100 million people,
100 million, so around
then
5
you look
million.
at 2
It's a
to
big
5
market,
million,
huh?
quite big, yes.
Dr. Fong, we have a question from one of our televiewers. That's
Yeah.
from Shane Manalo of Quezon City. If I have scoliosis, will my child get it? My child was diagnosed with adolescent idiopathic scoliosis. And what should I do?
Okay, that's a very, very good question. Reason being is that we do see a lot of cases where mom and dad does not have scoliosis, but all the children have it.
Yeah.
Then you also have cases where mom and
Because
dad
you
have
said that
really
it's,
it's genetics.
Yes,
That's right.
genetics.
Then you have cases where mom and dad have extremely severe scoliosis, but none of the children have it. But then you look at other patients where there's a very strong genetic link. And some studies actually show that there's a 30% possibility. But when we talk about genetics, sometimes it's not about your inheritance. So it could be developmental. It actually, in research, we talk about the Hox gene. So the gene that's responsible for growth modulation. So in some cases, it actually is not related to your parents.
Okay.
So just because your child has it, so just because you have it, it doesn't always mean your child have it. But it's always important to have it checked.
Okay. What would be the sign and symptoms for you to say
For
that, hey, this patient gets scoliosis?
Scoliosis.
Let's say
yes.
if I have a back pain, is that
Yes.
one of the sign and symptoms, or any
Okay.
pain or something like difficulty of walking or moving? You know, is that a sign and
Sign
symptom that you have
already.
scoliosis?
It's surprising as it is, a lot of patients with scoliosis have absolutely no symptoms whatsoever.
Okay.
So you will have someone walking down the street, and we do get a lot of patients, and when we're training the doctors in the hospital, one of the things we always talk about is what are the pain scale, or what are the clinical presentation. And a lot of the patients that present actually do not have any symptoms, and they may have absolutely perfect posture.
So where
Yeah,
will
so-
where will I go for consultation?
Consultation, yeah.
Let's say if I feel something on my back.
Yeah.
And
Is
what
it-
are the
yeah.
tests, Dr.
Is there
Cenica,
any
that they should do?
diagnostic tool that
That's right,
what we could
Undergo? They could
undergo?
undergo.
But before you answer that,
Yeah.
we will pause for a few reminders when What's Up Doc returns.